Hello everyone, this is Dr. Karan from DrPKLyfe. Today I wanted to discuss briefly about chronic fatigue syndrome, or other name is Myalgic Encephalomyelitis, ME or CFS. So over the course of 30 years of my practice, I've seen a bunch of people are diagnosed with chronic fatigue syndrome, although there are lots of misdiagnoses as well. And that's why it's really important that diagnosis is made properly and other conditions which may mimic chronic fatigue syndrome be excluded. So, what is chronic fatigue syndrome? It's a chronic condition where people feel fatigue. It's characterized by persistent, unexplained fatigue lasting at least 6 months. And it's not relieved by rest, and it's often worsened by physical activity or exertion. So called post-exertional malaise. And it can be associated with brain fog, joint or muscle pain, headache, and unrefreshing sleep. And it is a diagnosis of exclusion. That means other causes which may mimic these symptoms got to be excluded. So, other causes, let's talk about other causes because that's what's most important. Those other causes which may mimic like CFS should be excluded. Iron deficiency. So there are cases where patient is not anemic, there is no anemia, but patient has iron deficiency, relative iron deficiency, and that can cause also CFS without having anemia. So it's important to check the iron level even in people with normal CBC test. Ferritin level should be checked because ferritin level is a storage form of iron, and a low ferritin level can indicate iron deficiency. Iron level itself can be normal, but even if the storage form is low, it can cause chronic fatigue syndrome like symptoms. Vitamin deficiency. So, vitamin B12 deficiency can cause fatigue and neurological symptoms and brain fog. Vitamin D, which is one of the common vitamin D deficiency these days, there's a common reason people feel tired and weak. Vitamin D is extremely important for normal metabolism of the body. So if somebody got chronic fatigue and muscle ache and weakness, vitamin D must be checked. Adrenal insufficiency, called Addison's disease. There's a lack of adrenal hormone. It causes fatigue, weakness, low blood pressure, nausea, sometimes pigmentation of skin. So in that case, we check morning serum cortisol and ACTH level. ACTH is adrenocorticotropic trophic hormone. Other condition, post-viral syndrome or Epstein-Barr virus reactivation. Some individuals develop prolonged fatigue after viral infection like mono or COVID-19. So, and if you do the testing and it shows EBV antibodies, Epstein-Barr virus antibodies, that means there has been EB virus reactivation, and it can cause CFS-like symptoms. And by the way, there's no treatment for EB virus